thank you everyone. Thanks for joining us this evening. So my name is Sarah Quinlan and I am the Director of Radiotherapy UK. I am so delighted to welcome you all to the first ever Radiotherapy UK Talks webinar. And this is the first in a series of 5 workforce webinars that we're organising this year under the theme of new developments and innovations. And I am so thrilled to be kicking off the series with Professor Pat Price. So Professor Price has been at the forefront of developing and delivering innovation in the UK in radiotherapy, pioneering the use of PET molecular imaging and co-founding the Wilson Molecular Centre at the University of Manchester. As visiting professor within the Department of Surgery and Cancer at Imperial College London, Professor Price also specialises in advanced radiotherapy techniques and translational research in oncology. I imagine many of you will actually have written her name countless of times when referencing your essays as students, as she is also co-editor of the UK Oncology textbook, Treatments of Cancer. So Professor Price is also an incredibly active and passionate and effective advocate for improving radiotherapy services in the UK, both for the workforce and for cancer patients. Internationally recognised for her clinical and advocacy work, she is co-founder of the Global Coalition for Radiotherapy, and we are extremely lucky here at Radiotherapy UK to have her as our inspirational chair. Also, just to note that she's just completed her 7th London Marathon on Sunday there in her best time yet, just to add to all the other achievements as well. She's also a marathon runner, which is just phenomenal. So before I hand over to Professor Price for her presentation, I would just like to go through a little bit of housekeeping. So please use the chat function for your comments and your questions. This is such a good opportunity to engage with each other and with Professor Price, really, as we talk about the future of radiotherapy and what that's going to look like in 2033. And there will also be an opportunity for your questions to be put to Professor Price, and we'll do a Q&A session at the after her presentation, and we'll endeavour to ask as many questions as we can at that point. We're going to send out a follow-up email after this webinar with the recording and with any links that we talk about or we reference. So don't worry if you don't catch links or if you're wondering what that's about, we will be sending out an email following the webinar as well. So now if I could hand over to Professor Price.
Thanks, Sarah, that's great. It's a pleasure to give first of our series of UK RT talks, and obviously we welcome any suggestions and what we can do to help. So first of all, thinking about an introduction really about radiotherapy. Well, as we know, for those of us working in the field, we know it's a very fast-paced technology there, whereas the techniques move, we're always looking at ways to improving treatment and the patient experience. And that's really what we all want in the field of radiotherapy. I was just thinking back, things have changed quite a lot in my lifetime. I remember when I first started training as trainees, we were taught of the previous, in the 70s, technique of prostate radiotherapy, a 10 by 10 square centered on the second trouser button, because of course we had no imaging. And then of course we got better imaging. And I remember I was there and we had CT planning. That was exciting at the time. But I can also remember in my exams, hand planning. So things have moved quite a lot. Oh, it shows how old I am. So, and now we've got amazing thinking, if instead of just even checking with plain films, you know, port films we used to have, now we've got electronic 2D, 3D, 4D, enabling us all the time really to get these beams much more narrowed down to where we need to treat them, to be able to treat accurately with precision for individual patients, sparing normal tissue, tracking with movement, so many exciting things, and adapting as we go. So it's been transformational, really. I often describe it to people, it's a bit like mobile phone technology. You just can't even think back to what it was only, you know, 10 years ago. Amazing. And we know it's rapidly developing, it's highly technical, it's a field of medicine that sort of doesn't stop really, and it's probably the most technologically advanced field of medicine. And we're innovating all the time, and really it's all about improving patient outcomes. And we feel that the key to that is really having a plan as to how do we make sure we deliver these innovations as quickly and as radically and as optimally and cost effectively and evidence-based as approach as possible. And so that's what I want to sort of talk a bit about today. So next slide, Sarah. Okay, so just talking about the current environment. Well, it's been tough, isn't it, for everybody? COVID clearly brought about some unexpected issues, but it was astonishing that it's in this difficult time. SABRE, which was much needed focus, really was rolled out in that first year, which was absolutely great and fantastic for the workforce under really difficult conditions. And they were given that freedom to introduce it with the autonomy, enabling them to deliver it for patients, it showed just how amazing the frontline staff are. And it was one of the few examples where through COVID, the frontline staff were amazing. I've heard radiographers say sometimes a cancer patient, they were the first person they'd actually seen in person of their treatment. And all that pressure and all that compassion and skill is absolutely amazing. I think we know that there's innovation on the ground, looking at protocols and systems to enhance patient care. But also COVID exposed a lot of the fault lines in radiotherapy and highlighted the sort of systematic underfunding and under-resourcing of radiotherapy, which has astonishingly been there for so long. We are such a subject that is under-resourced. And I think that's a lot of it. There's a lack of understanding of how it works, how important it is. And currently we still have only about 5% of the cancer budget. In other countries, it's much higher. And COVID also halted many of the ongoing developments and much needed in research as well. Interestingly, an MP kindly asked a question of the Secretary of State yesterday in Parliament specifically about radiotherapy and access. The Secretary of State mentioned chemotherapy, surgery and diagnostic radiology. The word radiotherapy didn't cross his lips. So I think we've got a real education task here as well to get the message over. Next slide. So the workforce is our strength, really. It's all about technology and the workforce is amazing. I think we have to realise that what makes the UK special, and indeed radiotherapy services special, is the committed workforce. In the UK, we estimate there's only 6,400 in the workforce. That's treating over 100,000 patients a year. That's amazing. Therapeutic radiographers, the only part of the workforce where they have a whole degree in cancer. This is totally amazing. They are innovating, adapting on the front line, thinking away, improving patients' lives constantly. We feel that investment in the workforce is absolutely essential and is central to having any sort of radiotherapy service. The radiotherapy workforce is skilled and unique. And we know that such advances we've had in hypofractionation will be not so much about saving on the workforce capacity, about improving patient experience and ultimately the outcome. The workforce always have patients at the forefront and central to their developments, which is why they're the people we feel their voices should be heard, because through patients, the workforce can communicate this. So we feel that workforce is the key to unlocking radiotherapy potential, but they need to be given the resource and autonomy to do this. Next slide. So, what's the direction of travel of radiotherapy? Well, there's many of you may have heard of the European ground shot movement, and that's investing in really what we already have and collecting and sharing data and resources and collaborating within the UK and also internationally. It'll improve the way of networking, sharing best practice based on patient outcomes. many countries are already delivering innovative treatment with technology aligned to ours and workforce, but we need the resource and authority to get on with this. There's a lot of talk now about value-based care and implementation science, and how we really need to be knowing that what we're delivering, how much benefit it's giving, and measuring that, and how we can improve this. And it's absolutely vital. We feel obviously there needs to be workforce investment. We need a plan to increase the workforce. We need a plan for recruitment and retention, training, mentorship programs. And I think a lot is to continually support the amazing workforce we have in place already. Now, we talked a bit about research. It is well reported that patients in clinical trials in research do well, and we need hospitals that are actively research focused. And we know in radiotherapy we've delivered some amazing clinical trials. You think of the START, well, those of you are old enough to remember the START trial, all those patients in, we've done trials that have led the world, and it's thanks to our workforce. We need more national research initiatives and funding sources and resources for planning and infrastructure. And I know clinical trials have suffered in COVID, and now there's been all these debates about which ones can go forward and which future ones. But we must be making the case that this is part of our DNA, it's part of our being, because we're constantly wanting to innovate and improve. And there is so much technology there that we can do so much if given the chance. And talking about technology, well, I think, as we all know, it is a bit like mobile phones. Oh, what, AI, ChatGPT? Oh, there's new stuff everywhere. And I think we need to think that this innovation is coming. Some of it we just can't stop. But I think we need to plan for it. And I think we need to be now early and responsible adopters. I'm very saddened that it's taken a decade for everybody to be able to do SBRT in lung. I remember trying to advocate that in 2013. It's 2023 now. And that should never happen again. We should have systems to evaluate technology quickly, establish its work, its efficacy, affordability. Think of some innovative endpoints. We mustn't be constrained by so much of introducing technology seems to be within the model of introducing drugs, which is all about response rates and survival rates, and therefore the drug's better than the other. Technology has got so much more to it in terms of endpoints and what we should be doing about this. I think collaboration is the key, and I think as a UK network in radiation folk, we are amazing at this, but we need to build our capacity, and we need to reduce the workload for people as well, streamline our processes, be constantly collecting data, and ensure outcomes are measured in a timely way to really see the magnitude of benefit for patients. But we need to allow adoption of innovation to happen quickly and equitably. It's no good just the big centres having it. We must all be able to have this. We're only going to improve the health of the nation if everybody has the same access to healthcare, and everybody should have the same access to healthcare. Certainly, I've been really heartened with our technology partners over the last 3 years. There is a very good technology workforce with all of industry. Wow, gosh, they work well together. And they're really seen as a hand in hand with us, rather than just somebody trying to sell you something. So they've been great. Okay, so I think that's where we should be going. Next slide, Sarah, thanks. So I think there are some challenges. I think we have to be clear about this. I don't know if you realise, but the government announced there wasn't going to be a specific cancer plan. Now, cancer plans have been recognised as really important and recommended by the WHO, and they should be, clearly they should be comprehensive, they should be transparent, and they should be auditable. And if those three things are in place, they are shown to improve survival, and all countries are encouraged to have a cancer plan. We've had cancer plans over the years, and if you look in the literature, the House of Commons did a very good summary of this in 2018. 2015, I think it was, 2000, all over the years, been signed off by prime ministers, all that great work in the sort of 90s, 2000s, great. But now we're not having a cancer plan, we're having a general plan for comorbidities. People may have strong feelings about it, certainly I do, and I think just at a time when cancer's got so complex, we've had such a lot of disruption with COVID, and there's such a lot of technology, this is the absolute time where we need a designated cancer plan, and we need a designated radiotherapy plan. Interesting, the Global Coalition for Radiotherapy last week had a fantastic seminar. Oh, everybody was there. Mary Gaspadarowicz from Canada chaired it. Great. First of two parts, really talking about what's needed in a radiotherapy national plan to put in within a cancer plan. I'd advise you to go to the website for the GCR. The talks are there. The discussion was amazing. We're going to have a follow-up in June. Please do sign up in it. And we'll produce a template as to what people should have in this. And this is the way forward. And so we have to work towards this, I feel, as a group. We had an APPG for radiotherapy inquiry recently, and it was quite clear that there was a lot of problems overhanging now, and certainly a national plan was needed. Remember, we had the NHS CRUK radiotherapy vision for 10 years in 2013, so that's finished now in 2023. So we really need to be working towards this, and this is so important for us. I think there isn't a workforce plan. Jeremy Hunt did announce there's going to be one, so that's great. That's a start, but we need to speed up on this. And I know a lot of groups feel very strongly about this. Particularly, I know IPEM are feeling that the engineers aren't even in the group of people that they count as workforce. And we need to be bespoke for radiotherapy, and it's a tiny workforce. It's tiny compared. We're not talking 100,000 nurses here. We're talking 6,400 of us. Increase that by 1,000 would be massive. So we need this, and we need to think what's there for the future, and that balance, and making sure teams work well with new innovations there. Also, the concern is there's no planned investment in radiotherapy. We keep going on about it and keep going on about it. And it's as though, you know, if a new drug immunotherapy comes along and per patient they need £50,000, that's absolutely fine. Somebody needs a bit of software for £3,000, that's not okay. This is absolutely ridiculous. We should be absolutely screaming for investment. Now, radiotherapy is an infrastructure. It should be seen as almost a human right, just like you have electricity, you have internet, you should have access to radiotherapy. It's as simple as that. Investing in infrastructure always gives you a return on your money. And so we should be investing in radiotherapy. When you think, okay, say if you get a top of the range Linac, £2 million, okay, you can treat 600 or 700 patients a year for 10 years. That works out £400 a patient. This is nothing. So we really got to make the case that investment in radiotherapy you will get your money back on it big time, and we need the technology and software and all these other things. And I think we've been concerned that the leadership's been a bit diluted. I think in cancer in general, to be frank, and radiotherapy specifically, and we need people shouting a vision from the rooftops. And I think collectively we're very strong, and if we're clear on our messaging, we can be extremely strong. Nobody else is going to shout for us. And as I said, there's only 6,400 of us, and we need to be shouting very loudly. So they're the challenges. Sarah, the next slide. So what is the vision? Well, let's think big, I think, as what did one of those management gurus say? You should follow the vision and the thinking. As I say, Martin Luther King had a dream. He didn't have just an ordinary plan. So we need a vision for radiotherapy that we can all follow. And what should that be? This should be a patient-centered service where everybody has the access to modern radiotherapy that's precision, that's focused on the target, that reduces normal tissue, where your toxicity, where your data is collected and it's constantly innovated, and the workforce are not stressed and they are happy to deliver this, and then we can really move forward. And we need to do this. Remember, radiotherapy is needed in 50% of cancer patients and in 40% of cures. Now, the CRUK have said by 2040, we will have a third increase in number of patients with cancer. So currently, we have about 385,000 a year diagnosed. That's going to be 500,000. That's an awful lot more patients. Often obesity, all these other factors coming into play then. And also with the government's long-term plan, great if this comes on with early diagnostics. They're trying to get 75% of people diagnosed stage 1 or 2. Brilliant, fantastic. But what do we need to treat early stage disease? Surgery and radiotherapy. So hopefully we will have all these patients, many more patients diagnosed early, and they will need really high quality radiotherapy to cure them. So we need to be absolutely ready for this. So what do we need to do that? Well, we need to increase access. A lot of people dispute the figures, but the government's own figures are that currently only 27% of cancer patients have radiotherapy as their first treatment. And that's actually has been the same for the last 5 or 6 years. And the recent data out in 2020, 21, 22, exactly the same number. Whereas the HERO data, looking at our demographics of patients and ages and types of cancer, estimated, 2015, it should be 53%, and by 2020, it should be 60%. So there's a lot of people not getting radiotherapy out there. We knew the Public Health England study done 2019 before COVID of stage 1 patients, half should have surgery, half should have radiotherapy. Of the half that should have radiotherapy, half of them had no treatment at all. They were too far from radiotherapy centres, too far from SBRT. This is, and somehow it's sort of acceptable now. We've kind of said, okay, they don't get it. There was a radiotherapy audit for prostate cancer, intermediate risk prostate cancer. A third weren't getting it when they should be getting it. There are patients out there, we know in our own practices now with waiting times, perhaps we won't treat the metastatic disease or whatever, or patients aren't being referred. This is really not good enough. We must be pushing for increased access. A number of times I've been told by MPs, their constituents have said in rural areas they live too far and patients are just not accepting treatment. We've got to change this. It should be possible to treat patients, especially as the technology is able now. We've got to improve workforce capacity so we can actually deliver on these amazing tools and improve patient care. We also need a national equipment replacement plan for now. We've last, after banging on for about a long time, we've got a concession that ICBs now should be replacing their LINACs when they're 10 years old, although there's no necessary funding for this. So we've got to be constantly looking at this, because just replacing machines seems to be an impossible dream at the moment, whereas in fact if we were at standards of European standards, number of LINACs per population, we'd need 125 more LINACs in the country. So this is where we are at the moment. We are not good, and lo and behold, cancer survivals in the UK are at the bottom of the leagues. Are we surprised? No, this is what happens. So, and then also we've got to future-proof the service. There's such exciting things with immunotherapy. Look at that Pacific trial, stage 3 lung cancer. If you add the immunotherapy to the concomitant radiation chemotherapy, 10% improvement in survival, maintained at 5 years, more than 50% of people alive at that time. However, only 11% of people in the UK have concomitant radiation chemotherapy, and it's not licensed without it. And why is that? Because we haven't got the capacity, so people have to give sequential treatment, start the chemotherapy, then add in the radiotherapy. And so we can't have the immunotherapy. Now, as more and more things come down the line, we're going to have to be providing this. And now the immunotherapy companies are actually saying, I had one of them talk to us and said, Matt, what's the problem with radiotherapy in the UK? I thought, where do I start? So this is really, really important. And then coming down the line, gosh, flash radiotherapy, high dose rate, and also the more innovations with different iron species, as about whether there's a different mechanism of DNA damage going on that involves the immune system coming in. There is such an exciting future for radiotherapy. You know, we thought it was good before. This is amazing. And now with immunotherapy coming in, this is just going to be so exciting. But remember, we're prepared to invest in immunotherapy at, you know, £50,000 to £70,000 a year for a patient, but radiotherapy at £7,000 a course, we seem to be struggling over. So I think somehow we've got to get the message over there. So what we need now is to think about how we also introduce new technology. I think AJ Agarwal and others have done some fantastic research about looking at audits and making them openly accessible to patients. There was the prostate cancer audit looking at toxicity. So you could look up your own toxicity, and then when yours is a bit high, talk to the person who's a bit low. Some groups have changed their toxicity from 25% to 5% with some tweaks. That costs nothing. That's a massive improvement. If you had a drug that would reduce toxicity from 25% to 5%, you'd be making billions. And yet, have we got enough audits going on? No, we need this. So we need all these things and research and enabling technology that can move forward. So finally, in my last slide, I've been rabbiting on too much here. What are our goals really? And as a charity, we've been really, as you know, we've been advocating for radiotherapy for years. We were fortunate to be asked to be Secretariat for the APPG for Radiotherapy in 2018. We set up the Radiotherapy for Life campaign in 2019. And then with the COVID, we set up the Catch Up with Cancer campaign. And so we've been upping our sort of campaigning. We've got a huge amount of support from MPs. We've got about 45 members of the APG Cross Party, and they're just amazing. They're doing it for free, for nothing, goodness of their hearts, jumping up in Parliament, saying radiotherapy every 5 minutes. The amount of exposure we've had is amazing, but we need to influence government, and we need to influence the decision makers as well, to make sure they realise how important radiotherapy is. I know it's difficult. You can't just buy something and it's workforce and technology and people don't understand it, but it's not rocket science, and the frontline staff do understand it. We need to give radiotherapy the voice it deserves, and we need to support and give the workforce a voice. We need to advocate for equality of access so that the most appropriate treatment is given to all cancer patients. Because ultimately, what do we want to do? We want to improve the lives of patients affected by cancer. I think we need to think big. I don't think we should doing our all we'll try and manage approach. We need to think big. Patients deserve that. We need to think a world-class service. We are absolutely capable of that. We need to think a technology revolution. We need to think communicating our technology and our commitments. And we need to work as we are with teamwork between disciplines, between centres, with our industry partners, with international partners. And we need to have a vision where we're all connected. We can do remote planning. We can do remote training. All hospitals are equitable, stronger together. And therefore we can argue for this more resource, and that we should be in charge of our own direction. We shouldn't have things imposed on us by people that don't know about radiotherapy. We need to be saying what's right and then taking it forward. So I think I'll leave it there and hand back to Sarah.
Thank you so much for that, Professor Price. That was absolutely fascinating and so interesting to kind of see the different parts that need to come together, you know, in order for us to have equity of access to radiotherapy. So we've got lots of comments and questions coming through in the chat. So if you're happy enough, we'll maybe start with a few comments. I'll just note a few comments that have been made just on what you've been talking about there as well. Things like about how industry partners are so vital to radiotherapy services. And also a few comments just saying from people who've worked with you throughout your career, and commenting on your compassion and care for the patients and how that's shown through as well. So then some of the questions that have come through, there's a question from Tim just about do the politicians know about radiotherapy, you know, and they don't seem to have an understanding. And I suppose the lead on from that is, how do we get politicians to better understand radiotherapy, and what are the barriers to them understanding it?
I think what everybody should do in their departments is write to their MP and invite them. And let us know, and we can put pressure on them via the APPG to attend. I think it's purely a lack of knowledge, although to be fair, over the last few years, as we're having more and more meet and greet sort of drop-in sessions in Parliament, there is more and more understanding, to be fair, particularly amongst a lot of MPs have got relatives or whatever who've had radiotherapy themselves. So there is understanding, but there is not an understanding of what it takes to deliver it. So I would suggest if people could invite their MPs to come and attend their radiotherapy centre. MPs would like this, they could have their picture there and whatever. That would be a great help. I remember when we took a couple of the MPs, I remember Gillian Keegan, who's now the Education Secretary, when she came down to look at some machine manufacturers, she was blown away. So I think just, seeing is believing. I think that's a real help, and engage with them. And remember, whenever we have these drop-in sessions or whatever, we always put out a call where you can fill in the form to write to your MP to tell them to come. So, we can always tell you who your MP is. I think we just need to educate them. They're good people. They want to help. They've got a lot more other commitments, but just let's keep saying radiotherapy.
Okay, that's great, thank you. And then Debbie from Galway has a question, and I suppose it ties into some of the even some of the global work that you're involved in as well. But she's noting that there's a similar crisis in Ireland, and is looking for ideas on how to address it.
Yes, I know we've been seeing Ireland tweet and everything. It's been great. And it's really difficult. I think perhaps contact Sarah and talk to us, because I'm sure there's some cross-working we can do there about it. It's the same problems, isn't it? Interesting. I know Darren Ned's on from the Global Coalition as well. Remember, there's 38 countries in the world who have got no radiotherapy. So we've done a lot of work also now with Ukraine and their problems. They've got cobalt still, they've been bombed out. There's still, but generically, there is still about advocacy on the Global Coalition website. There's an advocacy toolkit. It's about explaining it in a simple way so people can understand it, which everybody is capable of doing. And it's actually giving those messages that hit home, and it's about how much it can do for patients, how needed it is, and how cost effective it is. And I think the main problem is it's because it's people, specialist people, and it's kit. Now, as there's been a lot of talk, there's a Good King's Fund review of sort of the deterioration in the NHS. And basically, because of all this knee-jerk funding and underfunding and everything, what has fallen back is the infrastructure money and the workforce money. What's radiotherapy? Infrastructure and workforce. So we've got a double whammy there. We've just got to keep shouting and shout together. So Ireland, come and join in. We can help.
Yes, I'm more than happy. If you want to have a chat about that, Debbie, feel free to give us a call anytime. And then there's a question just here around access, and whether you think the issues around access are more about the travel times or service capacity.
Oh, I think it's multiple things. I think it's certainly travel times. There are plenty of examples, cancers in an elderly population. If it's going to take you 2 hours to get there and you haven't got a car and it's in the winter, you're not going to go, and that's what people find. I think it is in terms of, I think we're very good at managing our own services. So perhaps we're, not always treating patients if we, if it's perhaps there's a capacity issue, if there's too long waits, because are there alternatives, these type of things. And ultimately, I don't think there are the clinical oncologists out there at the MDTs. A lot of the lung work has shown that, if you're in the periphery, somebody, if you haven't got a radiation oncologist on an MDT meeting, they're not going to say, that'd be fine. So, but there are ways we could do that and deal with that in terms of, getting protocols out there and communicating it. But ultimately, if we've got a capacity problem, if we're struggling to treat 27% of new patients at the moment, how on earth are we going to manage with all this, even if there wasn't an increase in number of patients? If, as the government wanted, to increase from 55 to 75% of early stage cancers, that's radiotherapy, either adjuvant or curative. Why has nobody connected the two? We have been, even at select committees, we've been banging on, great increased diagnosis, you've got to increase treatment. But I think we've got to scream it, because actually otherwise there's going to be a real crash. If we can't cope with 27% at the moment of 365, how are we going to cope with nearly 50% of 500,000? We're not, basically.
And that leads me on actually to the next question about obviously the work that we're doing to raise awareness, scream it, because Jackie asks, what can we do to support Radiotherapy UK?
You can do a lot of things to support radiotherapy, and perhaps Sarah, I will put that question back to yourself and Alison, but from my point of view, I want to thank everybody, because I find it, you know, personally, it's quite exposing sometimes. You know, if people know me, I don't like being in the front of things. And I've found everybody's support really, 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 really helpful on a personal level. And I know we send out things to the Champions Network and get information. We need information so that we can help. So interaction with us is absolutely important. We can only make the cases you're making. This is not my case. This is what we're getting from people. So it's so important. But Sarah, and Alison, there's probably some very practical ways you can help.
Yeah, there totally are. And maybe I'll just come on to them. I'll do a little bit after you, maybe about how you can get involved with us and support our work. I just want to get, maybe I'll just come back to some of the questions that are coming through the chat here.
Yes, and if we don't, we will get back to you as well.
Oh, yes, oh no, don't worry, I will cover it. I suppose just around, there's a lot of discussion around technology and how technology is needed for patient survival, but then how that interlinks within the workforce, you know, and that sometimes it seems easier to get money for technology than it does for the workforce to deliver it. And also that within the workforce, how can the roles evolve to keep up with demands? And I know that we've talked before about kind of, you know, the working offline and things like that, and supporting centres with specialists.
Yes, I think from what we gather from everybody, it's really, there isn't time and there isn't money for the training, is there? And that's what, so we need to increase the capacity. We need to do more online. Again, working with the global, there's a lot of innovative solutions that can be done remotely as well. But we need to prioritise that so that development is part of our being. It has to be, it's radiotherapy, we have to sell it as not a static treatment. It's constantly developing. So workforce development and technique development must be part of it. From what I understand, introduction of SBRT when there was that rush in COVID, it was purely just people didn't have the time to actually go and do it. So we need time, and we need facilities, and we need training budgets. And again, make the case, this is not massive budgets. This is not as much as immunotherapy.
And I think also just within that, there's comment around ICBs, and, you know, will they have sufficient funds to deliver this, and the need for a national programme?
Well, this has been very interesting, hasn't it? And I saw, Tim, thank you for your comment there about should the LINACs be with the Trust or the IC. Well, it's been very interesting. Talking to ministers and talking to Department of Health and talking to NHS England over the time, it's been a bit of a mystery what's going on. And to be fair, and Tim, you may know more than we do, actually, we seem to get very different discussions from people, very different information. I know centres have difficulties. They may be dealing with 2 ICBs. It doesn't seem to be clear where the information is, but we fundamentally feel that you know, I feel we used to have a cancer plan that the government were accountable for, and that the Prime Minister signed it off, and they were accountable for the extra to that. Then 2013, Langsley's changes, NHS England, so a separate body of people who come and go and who were in charge of things, and now that's dissolved down to ICBs, a bit of trust. And from what we can see, it's only becoming clear now what's going on. But from what I've heard from people is it's very difficult because people don't understand about this. And again, you've got to restart your discussions, or if you're having, so it's not quite clear yet where it is, but we still think you've got to have a national plan that's equitable all across the place, because otherwise, again, it's the sharp elbowed that are going to get what they need. And it shouldn't be like that.
Okay, that's great. Thank you very much, Pat. That's been absolutely fascinating as well. Thanks for all your insight and answers. I can just move on to the little bit about what people can do to support Radiotherapy UK here and pick up on that. And I just really wanted to let all the attendees know as well, just about Radiotherapy UK, about kind of what we do, what our vision is. We have just last year we went out for a consultation and we spoke to over 500 radiotherapy patients and their carers and over 250 members of the workforce, to ask them really what they saw the charity doing, where there were gaps. We have no desire to duplicate whatever other charities are doing. We're really keen that whenever we're a really small team, basically. So whenever we have time and investment, that we are using it to the best of its ability and we're making as big an impact as we possibly can. So our vision is to save lives by ensuring everyone in the UK has access to high quality radiotherapy treatment. And it's about equality of access. It means that no matter where you are in the UK, that you can access that advanced high quality radiotherapy. This is the team. As I said, we are quite a small team and growing, but we've got lots to do. But again, feel free, to contact any of us at any point. We're here to listen and we're here to help. And I say we're delighted to kick off our workforce engagements webinar series tonight, and there will be a whole series of them this year as well. So just a very brief overview of what our strategic aims and what we're planning to do over the next few years. So our campaigning, Pat has been talking about our campaigning and advocacy work already. And what's so important to us is that we are speaking up and out for the brilliant radiotherapy community and the patients. And it's about amplifying what people are telling us and bringing that to platforms where we can speak to politicians, we can be on the national media, and we can do our best to influence and really amplify your voices. This isn't about us being the voice. This is about us getting the information, understanding what's happening, and then putting that forward. We're Secretariat of the APPG in Radiotherapy, which is run by Tim Farron, the MP, and they're a fantastic group. We actually have about 7 vice chairs now, and there are cross-party vice chairs, and they are very supportive, and they do actually have a good understanding of radiotherapy and the issues at hand. And that's a really strong group for us to be able to have the voice heard within Parliament. And they're active and they hold inquiries, and I know hopefully a number of you will have responded to their inquiries. And that's really, really helpful. And then the Daily Express, so they have recently launched £1 billion for radiotherapy in partnership with ourselves and the Catch Up with Cancer campaign. And I mean, this is the first time a national newspaper has taken on radiotherapy as a crusade and as a plan. And this is fantastic. And hopefully you'll have seen us messaging out about it through the daily news, through your socials. And again, it's about helping us share that message, share what the Daily Express are trying to do. And we're also doing quite a lot of work in the background about pulling together the information, things that we're talking about this evening in the chat, like the age of machines. How many machines are past the recommended 10 years of age around the UK? Travel times, and surveying patients and professionals to really get a deeper understanding of what's happening on the ground. So we are all about information and evidence and data. That's really important to us, that everything we're saying is evidenced and supported. Within our patient resources, so one of the big things that came through from our consultation last autumn was that patients felt that there were gaps within their information or radiotherapy. Their cancer journey is quite well supported, and there's a lot of other cancer charities out there mainly working around the diagnosis, but I suppose we're really one of the only charities actually working around radiotherapy. And what they wanted from us was like one source of very trusted and up-to-date information. So we're working on that at the minute. We're working on making it incredibly accessible. We're collaborating with other cancer charities as well so that we can cross-signpost. And there's a bigger piece there as well about ultimately demystifying radiotherapy and communicating to the wider public of what radiotherapy is, so that, I mean, if 1 in 4 of the population are going to need radiotherapy in their lifetime, we need to be doing work before they actually getting the diagnosis and coming through to help explain what radiotherapy is. And then obviously within our workforce, it's about amplifying your voice. We have the flash surveys and we've had fantastic responses to them annually since they started. Last year, we had 10% of the workforce responding, and that gives us a really strong basis for taking forward your experiences and your opinions to government. And that survey actually was launched by Newsnight, who used it within part of their programming to explain about cancer wait times and about what impact this was having both on the workforce and on patients. And then also sharing innovation and engagement. That's part of what this these webinars are about. We have the Champions Network. If anybody's interested in joining up, please let I or Lindsay know. And ultimately, we really want to promote the profession because it's such a fantastic profession. People are doing such wonderful work out there, and not enough people know about it, and they don't know the impact that you guys have for patients. And we want to take that on, and we want to be able to promote that and to show people also in order to promote the profession itself and bring people into it as well. So finally, in response to the question of what you can do to support the charity, there are lots of different things you can do. So our annual Miles for Radiotherapy is launching tomorrow, and that is going to be starting on the 1st of July. And basically, if you can join, if you're an individual or a team, get your department together, set up some friendly rivalry with your neighbouring department to see who can track the most miles. And also it's only £20 to sign up, so it's super affordable, and you can fundraise on top of that for as much or as little as you like. And it's great motivation to get out in the summer months and get fit and also support our work. So you can sign the change.org Catch Up with Cancer petition, or email your MP by visiting our website, and we'll also put a link in the follow-up email, which we'll be sending out to everyone that has signed up tonight. And spread the word. I mean, when you're out, talk about your work, talk about the impact that you have, and highlight what is currently happening in the UK and the cancer wait times. And I suppose what we would say is, please do reassure people that these problems are solvable, and that charities like Radiotherapy UK are shouting out the answers loud and clear. And there's loud and clear for any decision maker, policy maker, or leader who wants to hear that. You can search for us on socials, and we would also say, if you're not already, do sign up to our daily news. It comes in your inbox every morning, and there's the latest research, advances, news about radiotherapy too, and it'll keep you totally up to date with everything that's happening in the world of radiotherapy. So, and I'll just say, finally, you can also register now for our next 2 webinars. They're with Stephen Tao of Leo Cancer Care. He's presenting on upright patient positioning and radiotherapy, and that's 8 p.m. on May the 23rd. And then Naman Julka Anderson will be discussing his ongoing research into radiation-induced skin reactions on the 22nd of June. So we will send out a follow-up email with all the recording, the registration for the upcoming webinars, and any other links or information that we have referenced tonight. So I suppose just kind of closing comments as well. There's so much potential for radiotherapy treatment in the UK. And what we can see from the comments, what we know from speaking to people on the front line, is that things are really challenging now. As you know, there's perhaps saying struggle to recruit, a struggle to retain staff, and patients are waiting a long time for life-saving treatment. So really the question is, how do we get from here to there? The vision that Professor Price has presented us with. And I mean, we are really the only charity in the UK advocating for radiotherapy treatment and speaking up for patients and professionals. And we know that nothing's going to change overnight, but we honestly believe that with us pushing back and keeping radiotherapy on the national agenda, both in Parliament, both in national media, and highlighting the incredible work that's currently being undertaken by highly skilled and committed workforce, you know, we can make change happen. We can have an impact, and we can totally get there. So if you have found this evening useful and wish to give something back, please think about considering supporting us in any way that works for you. And I suppose I would just like to say a huge thank you to Professor Price for giving up her time and for sharing her incredible knowledge, her expertise, and her passion. I think we're so lucky to have her on our side, standing up for the radiotherapy community. So we're in really good time, which is fantastic for our first webinar. And all that's left for me to say is thank you so much for attending this evening. And we're really looking forward to seeing you all again soon. Thank you.
Thank you.